हाँ उनको बोल दो लाइव आ गए हैं, बोलना शुरू करें। हाँ जी, हाँ जी। लिंक ज्वाइनिंग हमें कर दिया था।
हेलो, वो 1 मिनट मुझे एनिडेक्स में चाहिए सिस्टम, अभी डिस्कनेक्ट करता हूँ। 1 मिनट, अब कर्सर छोड़ दो। 1 मिनट, फ्लॉग ओपन करो।
Hi everyone, a very good evening. I am Dr. Afia from Medical Affairs team from Tata 1mg. As some of you are aware, the Tata 1mg is the largest healthcare online platform. Here you can book your you can book your test, you can get your medications online, you can get medically vetted expert opinions and everything. You can consult your doctors online as well. Here on the day of World Hypertension Day, we have curated online session to talk about hypertension, its risk factors, and to create awareness. Hypertension is a very chronic disorder which we don't give really importance to. Did you know that 60 to 70% of Indians don't know that they suffer from hypertension? So we have Dr. Anirudh Kumar, who is a DM in cardiology. Yes. We will be talking about hypertension and its risk factors and everything. Dr. Anirudh Kumar is here with us, who is a DM in cardiology. He has more than 10 years plus experience in hypertension, in vascular diseases, and peripheral artery diseases. We are here to start this session. Dr. Anirudh, please take it forward. We'll be glad to go forward with it. Also, if you have any questions, please put it in the suggestion box. We will be taking it later during this after the session. Thank you.
Thank you, Saida. Can I share the screen now?
Yes, doctor.
Is my screen visible?
Yes.
Yeah. So, good evening, everyone. My name is Dr. Anirudh Kumar. I'm a consultant cardiologist from Karnal. So, here I am today to speak about hypertension, what everyone should know. I think most of the attendees of this meeting will be commoners. So, let me put it in a simple way. First of all, I thank Tata 1mg for giving me this opportunity to speak on this specialty that is World Hypertension Day. So let's go into the talk. आखिर क्या होता है ये hypertension? So, is it a silent killer? Yeah, I would tell it's a silent killer. Silent killer, same as diabetes mellitus. It is the just tip of iceberg which is visible to us. अगर गहराई में गए तो पता नहीं होगा कितना गहराई है. So, according to the AHA, that is American Heart Association, it is estimated that 1.28 billion people are suffering with hypertension. And among the 1.28 billion people, 2/3 are living in low and middle economic countries. And 1 in 4 persons do have high blood pressure. And 1 in 3 don't even know that they have high blood pressure or hypertension. And what is the saddest part? Even people knowing they're hypertensive, how many people are in control? That is 1 among the 5 people are having their blood pressure under control. So what is new from American Heart Association? I take this meeting as an opportunity to tell regarding what is the most killing topic now presently undergoing in worldwide. It's not the age of 30 to 79. Now it's gone down to children. That is pediatrics and even adolescents are suffering from hypertension. And do you know what is the cause of it? It is due to childhood obesity. So let us know something little about heart. तो heart क्या है? वो कहाँ रहता है? और कितना बड़ा है? Heart is just situated slightly to the left from the center of the chest. And how big is it? If you take your hand and form a fist and put it on the chest, it is just as the size of your fist. So, what does it do? Heart करता क्या है? So heart basically pumps blood. But why does it pump blood? Because for survival of the human being, we need oxygen and energy, that is glucose, for every part of the body. And we get this oxygen and glucose through blood, which is again a function of heart to supply blood to all parts of the body. So how does this blood move in the body? So the blood moves in the body basically because through our blood vessels. So now comes to the main question. Does heart also requires blood? Yes, it does require blood, but it supplies its own blood through coronary arteries. What is blood pressure? आखिर सवाल क्या है blood pressure का? Blood pressure is the pressure created by the heart while pumping blood in the blood vessels to different parts of the body. So is blood pressure bad? No, it is not bad. Blood pressure is nothing but just like a minimum pressure required for the blood to move forward so that it can reach other parts of the body. समझ लो like if you go to a dhaba, you see many signboards like balloon signboards waving towards you. अगर मैं ये एग्जांपल पूछ लो कि अगर साइनबोर्ड एक ऑर्गन समझ लो या ब्लड वेसल समझ लो एंड जो हवा है अपनी ब्लड की तरफ सोच लो और जो मशीन रहता है जो पंप करता है वो अपनी हार्ट सोच लो. अगर मशीन ठीक से पंप नहीं कर पाएगा, अगर साइनबोर्ड दिखेगा आपको नहीं ना, it will be sticking to the ground. So same as that. अगर मशीन अच्छा सा पंप कर रहे तो साइनबोर्ड दिखेगा. समझ लो अगर मशीन ओवर पंप किया ज्यादा प्रेशर से क्या हो जाएगा? बलून बर्स्ट हो जाएगा. So that is the same concept which is here. So how does the heart pump? It is due to contraction and relaxation. So your heart will go on working. It is the only organ in the body which goes on working even in your sleep. Do you know your blood pressure value? I guess most of the people who are viewing this might not know what is their blood pressure value also. But to keep it simple, blood pressure value should be 120 to 80 millimeters of mercury or less than that. So, should my blood pressure be always normal? No. The answer is no. So, when is the condition like when can your blood pressure be high? So, when you're exercising, at stress, anger, fear, and when you don't have proper sleep, also, your blood pressure can shoot up. So, what is hypertension then? It is nothing but high blood pressure. That is, to put it in small words, a value of 130 by 80 millimeters of mercury, above 130 by 80 millimeters of mercury. जो सिस्टोलिक ब्लड प्रेशर रहता है वो 130 से ऊपर रहेगा और जो डायस्टोलिक ब्लड प्रेशर रहता है वो 80 से ऊपर रहेगा. So coming to history of hypertension, आखिर hypertension humans को कब पता चला? It dates back to Mesopotamian civilization, that is, during the Egyptians. It is around 2600 BC, where they said that, where they have documented blood pressure as hard pulse disease. Hard pulse disease, I repeat it. You know this person, right? Tutankhamun. There's a huge controversy how he died. But also, they give a reason that it is due to high blood pressure. He had a brain injury and he had passed away. So what is the treatment for blood pressure? Initially, we didn't have any drugs. So the initial treatment was leeches, actually. So people used to keep leeches because leech is the only painless organism which sucks and drains the blood out of you. So later on, around 200 AD, the people had started treating blood pressure through cupping method. And now we have drugs. We don't require those old treatment or harsh treatments which is there prior. So what is high BP? Is high BP a bad sign? I would tell yes. Why? Now see the organs which are getting affected here. Your blood vessels are affected. Kidney is affected. Eyes are affected. Brain is also affected. And even your heart itself is affected because it is working with high capacity to pump the blood. So how do you find out whether you have high BP? देख के बोल सकते हैं? नहीं. You have to go and get it checked. So you only after checking it, you can check whether your BP is high or not. So what are the causes for high BP then? So the causes of high BP are still not exactly pinpointed. Only we know is signs and symptoms. There are many physiological factors and pathophysiological factors which may cause high BP. So I'll put it simple that we can't point out what is the exact cause you got in high blood pressure. Who is at high risk for high blood pressure then? Age. जैसा आप age करेगा, समझ लो, most of the people or adults above age of 50 in males and in females above age of 55 are at high risk for high BP. People who have family history are also at high risk for high BP. And another is obesity. Obesity is due to lack of proper diet and lack of good exercises. And risk of hypertension, lifestyle. Stressful lifestyle causes high BP. Smoking, alcohol, and uncontrolled sugar can also cause high BP. How often should you measure your blood pressure? Any adult above age of 30 years should measure their blood pressure at least once in 6 months. Person who are overweight or a person who is obese needs to check their blood pressure frequently. People who are smokers and alcoholic also needs to check their blood pressure. So coming to blood pressure measurement, this is the quote which is given by a famous doctor, Dr. Kaplan. in 1998. It is the greatest clinical procedure, but yet performed in a sloppiest manner. So even a physician needs to measure blood pressure by giving it its utmost importance. Coming to blood pressure classification, let me skip this slide because it's not required for general public. What are the clinical manifestation for blood pressure? Most often times they are asymptomatic, means they don't show any symptoms, but often few people can present with easy fatigability, reduced activity tolerance, dizziness, palpitation, angina, dyspnea, and headache. बोले तो थकावट, सिर घूमना, छाती में दर्द होना, छाती दुखना, सांस खुलना और सिर दर्द होना. Complications of blood pressure. As I said to you, it affects heart, brain, kidney, and eyes. हार्ट में हार्ट की सूजन हो सकती, हार्ट फेलियर हो सकती, हार्ट अटैक भी आ सकती. ब्रेन में ब्रेन स्ट्रोक होने का बहुत चांसेस है. किडनी की किडनी फेलियर होने का बहुत चांसेस है. और आइस में ब्लीडिंग होके कभी कभी आंख नहीं दिखने का भी चांस है. तो यू कांट सी. Treatment goals. According to American Heart Association, what are the treatment goals set now? So whenever you're treating a person with PP, your target is to get the BP less than 140 by 90 millimeters of mercury for a normal adult. And अगर आपको diabetes और renal problem है, kidney का problem है, तो your blood pressure target is less than 130 by 80 millimeters of mercury. So how should you measure your blood pressure? Why did I put this slide? क्योंकि आप घर में भी measure करते रहते हो, या आपका बेटा या बेटी automatic blood pressure cuff लेके measure करते रहते हैं. So how should you measure your blood pressure? So first thing is you need a calm environment. टीवी लगा के या मशीन या कंप्यूटर लगा के blood pressure नहीं check करना है. You need a calm environment. The best method is probably you sleeping or you sitting on a relaxed chair with legs touching the ground. Even legs पे भी pressure नहीं रहना है. And before checking blood pressure, you have to check that you didn't smoke, or you didn't consume alcohol, or you didn't take coffee, because these things can alter your blood pressure. And जब blood pressure check कर रहे, you should not have tight clothings, and you should be very comfortable. At least check blood pressure after resting for at least 5 minutes. Even when a patient comes to me in my OPD, they are in a rush to finish off their work and finish off my consultation and go back to their work. They come with me with their readings high. I make them comfortable. I make them go sleep in casualty for at least 15 minutes. I go myself and check the blood pressure. Then only I will try to put them on drugs, or I will try to change their prescriptions. So equipment used for blood pressure. It could be mercury sphygmomanometer or a distal device or an anoid manometer. Nowadays, most of them are using automated devices. The only thing which I tell when you're using automated devices is it should be well calibrated, because calibration of automated blood pressure monitors are necessary. If not, in home, you'll feel tensed again, and you'll rush to doctor telling that, sir, mera BP recording bahut high dikh raha hai. So what is the ideal automated blood pressure monitor? Now see the symbol over here. This is the symbol of symbol given by AHA, that is American Heart Association. These are the models where are highly recommended by many doctors all over the world. So suppose if you go back to Tata 1mg again, you might get Omron and many blood pressure uh, equipments. All will be having these symbols. So what is ambulatory blood pressure monitoring? So ambulatory blood pressure monitoring बोले तो क्या होता है? Okay. There will be a small machine which will be hooked up to you and then the cuff tied up to you. And this will record your blood pressure 24 hours. Why is this 24 hours recording required? See, this is required, to check whether you are really having blood pressure, high blood pressure, or only when you're coming to hospital, you're having high blood pressure. And it is also to check how your blood pressure is under control. How much is it under control? There are many researchers, बहुत लोग स्टडी किया है कि ब्लड प्रेशर डॉक्टर के पास कंट्रोल में नहीं रहती. That is called as white coat hypertension. Might be because of tension that your BP might shoot up. And even अगर मेरे पास पेशेंट आया, पहले बार उसका बीपी चेक किया मैंने, उसका बीपी हाई दिखाई दे रहा, should I put him on drugs? No. I will never put my patient by just seeing single recording because he might have an undergoing stress. It might be mental stress, physical stress, anything. So I try to control his emotion. Check the BP at least after 3 hours again. If still high, then I'll try to investigate him. So this is called as dippers and non-dippers. So this is something which tells you whether you're really hypertensive or non-hypertensive, which can be easily assessed by 24 hours BP monitoring. So here it comes to a joke now. My God, your hypertension is out of control. So when most of the people are Google patients, I'm sorry to tell you, but most of them browse the web and come back to the doctor telling that this is breakthrough, this is the disease, this is my symptoms. Don't question the doctors, they're trained for that. You tell your problem, that's it, they'll try to help you out. So when a doctor tells you, just take medical breakthrough with a pinch of salt, after 1 week, the patient comes back and turns out to be hypertensive. What is patient's reply? Sir, I took every time a pinch of salt whenever a new medical breakthrough came down. So salt is also a risk factor for hypertension. How much consumption of salt is required? Not more than 1.5 milligram per day. So benefits of lowering blood pressure. People who are having high blood pressure, if they keep their blood pressure under control, they can get their stroke incidence 35 to 40% down, heart attack 20 to 25% down, and heart failure by 50% down. So here comes for another AHA joke, American Heart Association joke. As a doctor, we advise young people to work, or obese people who come to us to work out or walk for a long time, but they just sit on TV. That is why it seems his wife has hit his remote frequently so that he can go and walk around. As I said you prior, salt and hypertension has a good relationship. Your salt intake should be under control. If not, people who have family history or people are at risk of hypertension can turn up into a true hypertension. So that's it. I've come to my end of my talk. Thank you for giving me this opportunity. Stay healthy and stay happy.
Thank you, Dr. Anirudh, for this wonderful session. I will be taking up questions now. Uh, let's start with the first one. So, our first question is, can you elaborate a little more on what diet should people with hypertension follow?
It depends from which background you are from. I mean, it depends from different state people follow. I mean, India is a secular country. Each and everyone has their own beliefs and non-beliefs. To be particularly telling, I would tell that you have to. There's something called dash diet in website, but it is difficult for everyone to follow dash diet. For vegetarians, yeah, it is pretty easier because most of the products are rich. But for non-vegetarians, your non-vegetarian consumption is restricted to only poultry and fish. Red meat is not suggested as of now for people with hypertension or risk, not only hypertension, for, for a good cardiovascular health also. And as I said you prior, your salt should be restricted. Salt is a boon and a bane. Until unless you're not infected, it's still a boon. But once you're suffering, it's a bane.
Sure. Can you elaborate a little more about DASH diet?
Dash diet consists of mainly fruits, leafy vegetables, leafy and starch vegetables, less amount of carbohydrates, good oils. Like you can take any oil. Any oil is good for you, except like palm oil. Probably it's not so great when you're consuming. Any oil is good for you when you just heat it in a normal temperature. Once you overheat, let it be olive oil, avocado oil, any great oil, it loses its protective property. Lots of salads with olive oil toppings will be good. And as I said, you poultry and everything is included. But consumption of poultry is also restricted, not frequently. You should not consume it frequently, probably weekly once. Egg is okay, but no, chicken is not so good if you consume it daily. And no fries. Take as much as boiled food.
Sure. So the next question is, suppose you are suffering, a person is suffering from hypertension, but now the recordings are under control. Should they continue with the medications or no?
You have to absolutely continue your medications. Just because you're on medications, that is the reason why it's under control. Once you stop, it might cause sudden overshoot of the BP, and it might cause even more worse problems than you imagine. It can cause stroke, it can cause heart attack also. So that is the reason why before discontinuing medications, kindly consult your doctors. Don't discontinue without any prescriptions or until unless your doctor tells you to.
Sure. So the next question is, there's a person who's telling that he has his BP readings around 190 to 1 by 120 and then 171 to 105. They are on a medication amlodipine, but they want to know what else can they do to keep their recordings in control.
It depends on how much dosage of amlodipine are you on and how frequent are you taking. But yet, simple amlodipine, according to the new protocols, is multiple drugs. I mean, simple amlodipine will not control such a huge BP or blood pressure. You have to take multiple combination of drugs which are available in the market. I would suggest you kindly consult your physician, family physician, or a proper cardiologist, so that he will assess you first of all. What is the exact cause of your BP? Is it due to age, or is it due to secondary causes? There are a few secondary causes which, if corrected, you might not require blood pressure drugs. Very few. And most of the population doesn't fall into the secondary causes. Mind you, again, most of the population comes into the primary causes. That is, cause is not known.
Sure. Doctor, can you talk about few early signs that we have to look out for if we want to check we have blood pressure or how to go about it?
Early signs per se, as I said, you most of them are asymptomatic. But if your family, अगर आपके घर में पापा या ममा is suffering from blood pressure, या आपका मामी और या दादा दादी कोई भी blood pressure से suffer हो रहा है, then probably you should go and get yourself checked after you age 30. 30 is the probably the lowest limit which I would tell you should start taking care of your body, because body gets into relaxed mode. You'll start earning. You'll be restricted to chair job. Even doctors are restricted to chair job now, most often. Though even because we are our sleep is disturbed. In fact, because we don't know when we get calls. But yet, never leave your exercises. Exercise well. Keep your health check at least annually once after 30, so that you'll know when you're at risk, or at least you're a silent carrier of hypertension or diabetes. Because once they're blown out, you don't know what kind of organ damage you might have.
Doctor, the next question is from a person who is telling that they have psoriasis, an autoimmune condition. So they want to know they are on beta blockers. Can beta blockers trigger autoimmune conditions or worsen it?
Psoriasis per se, beta blockers won't affect psoriasis, but yeah, there are few diseases where you have to restrict your beta blockers. Vasculitis is such condition where you can't take beta blockers. So prior, it's simple psoriasis, or is it involving blood vessels through some other autoimmune causes should be known. So that's the reason I say every time go consult your physician.
So, if a person has blood pressure measuring up to 150 by 100, they want to know should they consult a doctor and start their medications or keep it like with regular checkups and healthy diet and exercise?
So basically, it depends on where you're getting your blood pressure measured. Is it at work, or is it due to stress, or is it all the conditions which I've mentioned in my talk? The best thing is be calm and lie down in your bed. If you're running an automated machine, you can yourself press the button. It'll check now. It'll take three readings. The new machine takes three readings now. It'll give an average of all the three readings. So once you get the average of the three readings, even on your rest and in your calm position, if they're high, yeah, you need to consult your doctor. Get yourself checked whether your blood pressure is showing effect on heart or any other organs, and depending on that, you can start your treatment.
Also, doctor, how does homeopathy work for blood pressure? Like, is it advisable? Is it good, or should we like not think about it?
I'm not against homeopathy or anything, but the thing is, since I'm a science student, I go with researchers. I go with facts. So most of the guidelines which are framed are on the research and facts which they have studied on human beings, not on some animals or something. If homeopathy is giving a good option with its research, then I think I have no restrictions against it. It's up to you. But for me, yeah, I go with something like facts and research. So as of now, I would prefer allopathy.
Also, are there any medications like hypertensive medications that are safe to be used long term? As we all know, no medication is safe. It comes with its pros and cons.
Every medication has its pros and cons, and probably it might not show now. It might show in future also. That is the reason why we tell or why a doctor doesn't prescribe medications not more than 1 month or 2 months or 3 months maximum. Depending on how frequently he's seeing the patient, he might maximum prolong for 3 months or 6 months. That's it. After 6 months, he'll again ask the patient to review back. That is the reason why they needs to check back on the patient. How is per se if I go on few medications like amlodipine. Amlodipine causes swelling in legs for few patients, not for everyone. So they have to check whether it's happening with them or not. Suppose if I go for ACE inhibitors or ARBs, they can cause kidney problems. So not initially, but in the initial stages. Sorry, it's in the initial stages. So I'll ask the patient to come back, turn up after 1 week or 2 weeks, and check his RFTs, whether there is rise in serum creatinine or not. So it depends. It depends from patient to patient. As he ages, our kidney function goes down. So whether I should continue the same dosage of ARBs or ACE inhibitors will be a doubt when I check the patient at that time. So it is better to keep in touch with your doctor and follow his instructions. Whenever he asks you to come back, kindly go back and check it.
Okay. Can hypertension be reversed? Is there any chance of it?
As I said, the secondary hypertension, that is 5% of the patients, after removing the secondary causes, they might have, I can't tell it's completely reversed or so, but it is very well under control. Few people might be off drugs. I mean, they might not require drugs at all. Very few people.
Does sleep apnea has any connection with hypertension? If someone is suffering from sleep apnea, then
Yeah, it does have. Sleep apnea basically is due to obesity or obesity or overweight. So once you get your sleep apnea, it triggers your sympathetic system. It controls your sympathetic system during sleep apnea. Your control on sympathetic system is affected. So it indirectly disturbs your blood pressure. So controlling BP is one of the, suppose people come frequently with uncontrolled blood pressure, we often check for sleep apnea in obese people or overweight people. So that if suppose we treat sleep apnea, then probably the amount of drug or the dosage of drug he'll be requiring for controlling blood pressure can be titrated.
can you talk a little bit more about sleep apnea? Like explain it to our viewers.
Sleep apnea is basically a disease or a condition. I will not tell. It's a condition where आप सोते रहते हैं और सडनली आपका सांस लेना बंद हो जाता है for few seconds. So we measure this duration और सांस लेने बंद होने का एपिसोड मेजर करते हैं हम लोग. So depending on the score, there'll be a scoring system for sleep apnea. So depending, if suppose more than these many cycles of apnea, बोले तो सांस लेने का बंद होना is known as sleep apnea. So these people often will have disturbed mornings. They'll get tired very easily, and they won't fall to sleep also very easily. And they have snoring too.
Sure. So there's one question where the person has elaborated a lot. Sir, मैं 3 महीने से Timol 40 tablet ले रहा हूँ, and his BP is around 140/90. So what should he like continue with the medication, or like is there anything else that he needs to do?
Easy kidney, it depends again. I said you right. Your target depends on what kind of disease are you suffering from. Are you hypertension? I mean, it's only just hypertension, or is it you're on your diabetes problem है या kidney problem है या आपका heart affect हुआ है. So 140/90, if suppose he's just hypertensive, also there is a study called Sprint trial tells that strict control of blood pressure is important. 140/90 is just for patients' sake. We tell them so that they don't feel anxious. But we try to control as much as low we can go on.
So there is this patient who says that their wife is on had hypertension earlier, but now their BP is very low, and she's not been taking any medications of late. So it's a very unique situation, but that has happened.
Uh, I'm sorry to tell regarding this, but most often this phenomena is seen in women because their hypertension is mainly due to anxiety, stress, or sleeplessness, which might have triggered during certain period of time. Probably when the stress is resolved or something, her BP might have been under control, and his or her physician, sorry, her physician might have removed the drugs, or sh- it might be a condition where your heart is failing, your BP is in lower side, and you didn't go and show it to your physician at all, thinking that your my BP is under control, I can not take my drugs.
Okay, with high BP, do you have the shortness of breath? Because there's this patient who says he's finding a difficulty in breathing. Are these the symptoms of high blood pressure?
The difficulty in breathing is one of the symptom of high blood pressure. इनफैक्ट आप जो बता रहे स्लीप एपनिया उन लोगों में भी डिफिकल्टी ऑफ ब्रीथिंग रहता है. So it's not the particular sign for hypertension, but it is one of the symptoms. So it depends on what kind. When are you feeling difficult in breathing, like in rest, or after sleeping, or after walking. So depending on condition, the disease varies.
Any lifestyle modifications to manage hypertension?
To be coming to the fact that I said you the diet. Now keeping the diet apart, the first thing is restrict your calories, which again comes into the diet. Sorry, and the second thing is exercise. According to American Heart Association, at least 30 minutes per week. You should brisk walk. It's not just normal walk, brisk walk. Again, I'm repeating, brisk walking. आराम से फोन में बात करके वॉक करने का नहीं है. You should not concentrate on your phone. You should concentrate on your walk, and it's very brisk walk for 30 minutes at least per week is what is recommended. But as for my experience, at least 10,000 steps per day. 10,000 steps per day will burn your calories a lot and get you leaner also. I mean, it shreds your weight if you're obese and overweight also. So count is 10,000 steps per day. It depends on how you walk or what. It's up to you, but your average count should be at least 10,000 steps per day. Gym and all, it depends on you. I would not tell go on first day only and run or do gymming and all. Do a graded exercise. If you just go now and start suddenly running, even you will feel breathless. In fact, I will feel breathless if I go suddenly start an exercise. So keep your body warm up. Do some warm up exercises. Start working, then start running slowly. So your heart is acclimatized to the change of environment. That is, you're exercising suddenly. So it is acclimatized to that. So that there's not much load on heart suddenly and you start feeling breathless. And at the same time, simple things like yoga are, sorry to tell that we stopped doing yoga and Japanese have more fond of yoga. Yoga and meditation also controls everything. Meditation relieves stress a lot, and yoga will also improve your vagal tone and control your heart rate and everything. It increases your flexibility. It increases your heart. It controls your heart rate. It keeps you fresh. At the same time, it has many other physiological effects on your body. So even yoga is also okay. I don't know. I'll not suggest you every time go to gym and get slim and everything. Even simple yoga can also help you out.
सर हाई ब्लड प्रेशर होने से क्या पैरों में सूजन आ जाती है और उसको कैसे मैनेज करना है?
It depends on what kind of drugs. Is it because of drugs or is it because of kidney problem, or is it because of heart problem, failing heart? So until unless you can, if you don't visit your physician or a cardiologist, we can't solve this problem. I'm sorry, we can't solve this problem on a meeting. So it depends on what kind of condition you're going through. But I would tell that restrict your salt diet. Even if you're having kidney problem or even if you're having heart problem, you should restrict your salt content. Especially if you're having heart problem, salt is like a slow poison to you. Salt is restricted to almost like a pinch.
Keeping the interest of time, we'll be taking last two questions now. So this
Sure.
question, we just want to understand: was there any connection between hypertension and COVID? Like, are they interrelated? कि कोविड होने से हाइपरटेंशन आ जाएगा या हाइपरटेंशन होने से कोविड के चांसेस इंक्रीज होते हैं?
Hypertension and COVID. COVID has one problem which has seen, which we have observed is there is autonomic disturbances in many people. So it is basically completely scientific. I can't put it in simple words. Sorry. So basically, आपका nervous system जो है उसमें थोड़ा dysfunction हो जाता है COVID में. So which is observed, but it is reversible also. It's not like it is permanent there. But फर्स्ट से हाइपरटेंशन सबको होने का चांसेस नहीं है. कोविड हुआ तो हाइपरटेंशन होने का जरूरत नहीं है. इट डिपेंड्स ऑन हाउ बैडली यू वर अफेक्टेड ड्यूरिंग कोविड, because COVID had involved each and every organ per se. So you might have had some kidney problem during COVID, or you might have had some lung problem in COVID. Lung problem is common, which you had seen. How severe is your lung problem? And few people had some heart blocks, stroke problems in COVID. So it has caused many disturbances per se. The COVID is some disease which has involved almost every system. So yeah, hypertension, there is a relationship with there is indirect relationship, not a direct relationship for COVID, but yes.
Okay, one of my personal questions now. I just want to know if smoking is a risk factor for hypertension. Like, how bad is it?
Smoking is definitely a risk factor for hypertension. We'll leave about the probably around 150 carcinogens in a cigar. Yeah, probably around 150 carcinogens in a cigar. Leave about that. Nicotine itself can boost. I mean, people tell that put nicotine patches to quit smoking and all. Nicotine patch, nicotine, the drug nicotine itself can boost your blood pressure for a few minutes after smoking. At least for 30 to 40 minutes, you'll be having blood pressure readings after smoking. That is the reason why when you measure a blood pressure, you should ask whether your patient or whether the particular person had smoked or not. So, per se, I would tell that quit smoking and keep your alcohol content alcohol consumption under control. I know I don't believe that everyone will quit alcohol because it's been an addiction for many of them, and many people think it's like a trend. But still, I would tell keep your alcohol consumption low as possible, probably 2 picks per day, kind of. So at least you'll be under control, and your health is under control.
Okay. So thank you so much, doctor, for this informative session. It was very interactive, informative, and very easy to understand. Thank you for your time. Thank you for all the information that you've given us. I would also like to thank all the viewers. Also, please don't forget to subscribe to Tata 1MG's YouTube channel for more such informational content. Thank you. Thank you all.
Thank you.